Hey, quick question. I have told you my name in every one of these videos that I have ever made. Do you remember it? I will teach you how to do it on this episode of One for the Road. You know you've been there. Whether you're on a call or you're at a party, you introduce yourself to a person whom you've never met, they offer up their name, and then the conversation moves on. And 10 seconds later, you think to yourself, I have completely forgotten this person's name. You've done it, right? We all have, and it happens all the time on medical calls because we're often in a stressful situation, which makes remembering something that seems inconsequential, like a patient's name, difficult. But names are anything but inconsequential. Names are perhaps the most powerful rapport-building tool that we have. Patients respond quicker and they fall into rapport with us faster when we utilize their name. Your name is the first thing that you are given when you enter this world. It's the last thing you leave behind when you're gone. Don't underestimate the power of knowing and using the patient's name if we can just remember it, right? So here's a trick that has been around for a long time and it endures because it works. Use the patient's name twice in the first 30 seconds of patient care. That's it. It works. With just 2 repetitions of the patient's name, you'll fall into the habit of inserting it occasionally here and there, and by the time you're en route to the hospital, you're like 2 old friends. I'm serious, it works. But at first, it can feel awkward, so it helps to start with a plan. Here's a few easy phrases that after some practice, they won't feel right saying without including the patient's name. Here's one. Sir, my name is Steve. I'm with the fire department. What's your name? Bill, can you tell me a little bit about what happened today? Has anything like that ever happened to you before, Bill? That's it. Now that you're incorporating Bill's name into the questioning, you'll find it much harder to forget it. Hearing yourself say the patient's name out loud, it cements it into your short-term memory, and then you and Bill are going to get along just fine. Give it a try. See how much easier it is to build rapport with your patients if you use their name. I wish you luck. I appreciate your attention. Thanks for watching. I'm Steve Whitehead, and that is One for the Road.